how the gastric emptying time is going to affect the drug absorption. I just give you few example ideas like delaying the gastric emptying has advantage also, delaying gastric emptying has disadvantages also. So advantages maybe for those drugs which is dependent on the food. Food dependent absorption is happening, or the food dependent, like other way, dissolution is happening, or maybe the dissolution is happening because of the fluid content of the GIT, the constituent of the fluid of the GIT. So like this, it can be an advantage or it can be a drawbacks, like as we discussed last time. The drawbacks may be for those drugs where the onset action is required and it is delayed because of gastric emptying delaying, because it is not reaching the absorption site, or it may cause irritation because unnecessarily it is retained at particular place because of slow gastric emptying. And the next one is instability of the drug, which is sensitive to the particular pH, and you're making the drug to, or the drug is getting unnecessarily retained in the particular pH where it is getting degraded. So like this, we also got idea about the various factors which can actually affect the gastric emptying. Okay, there are a number of factors are affecting the emptying itself. Means the emptying process which happens, that is the stomach emptying process, or even intestinal emptying process. Because as I told you, intestinal emptying is dependent on the stomach emptying. After that process only, you can expect the intestinal emptying to happen. Fine. So these are the factors we just went through last class. And also, I stressed upon the intestinal motility. It is also important thing which can affect the absorption of the drug. And whenever we are dealing with the modified release dosage forms, we should be very carefully understand this process happening in the GIT, so that it will not unnecessarily result in the uh, dumping of the dose at particular region. Because slow emptying, what happens, the tablet may not move further, and but the drug will be just releasing out of the tablet, because it is modified release. It will not actually make out unless until you had a specific polymer. It cannot sense what is the environment. Even if you had specific polymer also, you cannot expect that everything it will understand the dosage form. Its function is just to release the drug. It keep on releasing the drug, it doesn't even realize it is in the stomach or in the intestine, unless until you had a particular polymer which is sensitive to the acidic pH or in the basic pH. That's what called as an entry protein. So there is a lot to discuss. It's out of your subject, because it's a pharmaceutics related detail subject, okay, which we cannot deal in this particular subject. But modified release means there are varieties of modified release dosage form. So its integrity or the release of the drug from this dosage form is dependent on the stomach emptying as well as the intestinal transit time. Got some idea about the circulation happening with a particular region, especially the intestine. Okay, circulation happens everywhere, but in the small intestine, the circulation is more because of highly perfused capillary network. Also, the lymphatic circulation. So, targeting the drug to the lymphatic circulation can be advantage because it bypasses the first pass metabolism. That's what I was trying to tell. Hepatic circulation is nothing but what? The drug first enter into the liver through the mesenteric vessels. Mesenteric vessels are the one which are present surrounding the smaller intestine. So enter via mesenteric vessel to the hepatic portal. The hepatic means liver. But in case of lymphatic circulation, directly it bypasses the first pass metabolism and it goes into the bloodstream. So there are some approaches which you can just to have an idea. That's all. You can design the dosage form such that it can be directly targeted to the lymphatic circulation. And some of the best examples are liposome preparations and self-emulsifying drug delivery system, SEDDS actually it is, self-emulsifying drug delivery system. Remove this one additional D. And next one is the lipid-based nanoparticles. So these are only 3 examples I've given. Like this, there are many dosage form designing can be done, which you can target to the lymphatic circulation, keeping in mind the particle size. If you can manage the particle size, even without converting into liposomes or self-emulsifying system, you can expect the drug to enter the lymphatic circulation. Okay, and what happens? See, another approach is like approach for lymphatic circulation is, so this poorly water soluble drugs are soluble in oil and lipids, which may dissolve in the. So this is a mechanism. What? How does the lipophilic drug molecule? The candidate for the lymphatic solution should be highly lipophilic in nature. Okay, and we should have a suitable particle size range. Okay, and what happens to that lipoidal drug molecule is it get actually mixed up with the oil and the lipids which are present in the that is GIT tract, because this would have come from the food contents. And similarly, how the oil and lipids get digested and absorbed, no? So and that happens because of the presence of chylomicrons. These are the nothing but triglyceride and lipoidal substances which are released from the enterocytes of the smaller intestine. Okay, these chylomicrons are the one which helps in solubilizing the poorly water soluble drug. That is a lipoidal drug molecules, and that's how it absorbs systemically by the lymphatic circulation. Means it enters the lymphatic circulation and then go to the systemic circulation. Absorbed systemically via the lymphatic circulation. Means it goes to the lymphatic first and then to the systemic. Naturally, if it happens, or I can also design them something like this: liposomes, self-emulsifying system, and lipid-based nanoparticles. So, okay, that's about the perfusion. One of the factor related to the perfusion of the GI tract, which may be blood flow or the lymphatic circulation. So now the next part is effect of food on GI absorption. See, we understood the anatomy and physiology. How does it affect the absorption? Okay, anatomy and physiology mainly talks about the motility. Okay, or which is related to the transit time. That is gastric emptying time or intestinal transit time. All these are related to the anatomy and the physiological property of the GI tract. But within the GI tract, there are other things also there, as I told you. Okay, and among those constituents, one of the constituents, food itself. So this behavior, the anatomy and physiology of the GIT depends on the food what we consume. So that's why the next factor exclusively we are discussing on the effect of food on GI absorption. Okay. So these are the things which can happen when in general presence of food either delay, reduce, increase or may not affect absorption. There are so many consequences, like it can be positive, it can be negative effect. The food can be have a positive, maybe having a positive effect. Food may also have a negative effect because it can delay, reduce, increase, or increase the gastric motility. So many things can happen. So the presence of food, these are the things which can happen. Whatever I'm highlighting in the bullets, no, these are the effects of food. Okay, or the presence of food affecting the bioavailability of the drug. Okay. Instead of writing absorption, I have written here bioavailability. As we all know now, the absorption definitely affects the bioavailability of the drug. So the food can change GI pH and solubility of the drug. These are the effect of the food. It can delay the gastric emptying. It can stimulate the bile flow. Food can stimulate the bile flow, or it can increase the blood flow. Okay, or change the lumen metabolism of the drug because the presence of the food. Physical and chemical interaction of the meal with the drug means the food content with the drug. So food can interact with the the drug can interact with the contents of the food. Okay. So these are the consequences or the effect of presence of food. So anything can happen that depends on the nature of the food. See now, when I say effect of food on the food can have the effect like this, again, it depends on which type of food. So it's not again very simple, but at least we'll understand some of the examples. With example, what are those effects? So one of the example, the negative effect, let us see. See, as I told, the food effect can be positive effect, food effect can be negative effect. So some of the antibiotics, especially the penicillin and tetracycline and other hydrophilic drug molecule, its absorption is decreased in the presence of food. So I recommend you while writing, if at all you are noting down, draw two columns where you can write one is the positive effect, another one is the negative effect. Okay, so you can start segregating it as a positive effect of the food and the negative effect of the food on the absorption. Positive means absorption is increased, negative means absorption is decreased. So first example is antibiotic absorption is decreased, and well-known example are penicillin and tetracycline and some hydrophilic drugs. Where other than the penicillin tetracycline, there are also hydrophilic drugs whose absorption is decreased because of the presence of the food. Next one, glycoflavin. I think already we came across about the example of glycoflavin, whose absorption is enhanced in the presence of the food because glycoflavin is highly lipoidal drug molecule. Okay, and most of the high lipid lipoidal drugs can be solubilized in the presence of the food, or its dissolution is increased in the presence of the food. Thereby, absorption is also increased. So, lipid soluble drugs such as glycoflavin, metaxalone, and metazolone are better absorbed when given with the food containing high fat content. So, I can conclude here high fat content, that is your oily substances, rich calorie foods, whatever you consume, no? Fat, like your dates, cashews, all that. Okay, high calorie food or high fat content food will enhance the absorption of the lipid soluble drugs. At the same time, same high fat soluble content food will decrease the absorption of the this antibiotics and any other hydrophilic drug molecules. Further, in continue examples only I'll be telling, you have to start segregating it. So we are trying to understand the effect of food with respect to these points. Change in the GI solubility, bile flow, increase in the blood flow, all that. So try to match this example with respect to these points. So the next one is the bile flow. See, the bile flow, we know the bile which is secreted from the bile duct helps in the digestion of the oily substances or the fatty substances, which results in the formation of the micelles. And that micelles, nothing but head and tail, all that, polar head, lipid tail. Okay, this micelles actually helps in the solubilization. Like your soap, when you mix with the water, how it form the floating, no? You can imagine, like when you wash the oil content vessels, so when you add the soap, what happens? The oil gets blended with the soap content, and that results in the solubilization. Similarly, you can imagine here also the bile, whichever is secreted, will result in the solubilization of the lipid soluble or the fatty contents, which then later results in the good absorption. So presence of food, whichever can stimulate the bile flow. See, bile has its own function, fine. Even that stimulation can be enhanced. So presence of food can stimulate the bile flow, and the bile acids or the bile are surfactant in nature. It's for your knowledge, okay? And in nature, and results in, there's one word missing in the sentence, and results in digestion and solubilization of fat soluble drugs through micelle form. This is the mechanism. If at all you're wondering how exactly it increases the absorption of lipoidal drug molecule, it is mainly because the bile causes the digestion, results in the formation of the micelle, and that micelle is actually responsible for the good solubilization and the absorption. That is the positive effect. Some of the drug you can imagine enhanced bile flow is an advantage. Which kind of drug? Lipoidal drug molecule. Okay, that is lipid soluble, I can say. Lipid soluble drug substances can be easily solubilized in the presence of the bile flow. The negative effect is the second one. It decreases the absorption of some of the drug neomycin by forming water insoluble complex. Okay, so this is a drawback. So the bile secretion can be a positive effect, can be again the negative effect. So when we are dealing with any drug substance which we know that it is affected by the presence of the bile, so we can avoid giving the food which actually stimulates the secretion of the bile. Got it. This is how you are going to decide about the dosage regimen, whether it should be given with food or not or in the absence of the food. So you can now start correlating. Please try to understand. So how exactly? See, when I say dosing regimen, simple to just say that this amount, this many times you need to take, and this many days you need to take, or this time gap. Paracetamol, for example, we know every 6 hours we need to take. Okay, continuously for 3 days. If they recommend, you have to take every 6 hours for 3 days. So that information, okay, whatever we give confidently, very confidently to the patient nowadays, that information is derived based on the understanding of all this. So coming out with a dosage, proper dosage regimen needs a proper understanding, and which is substantiated with the experiments also. Then only it can be given confidently to the patient. Of course, all the approval process which happens in through the FDA. Okay, just for your knowledge, means a designing of the proper dosage regimen needs a proper planning, and that can be done only when we have a thorough knowledge of each and everything about the drug molecule, and also the knowledge of the anatomy and physiology of the body. Okay. So next one is the citrazine example. That was about the bile, positive and the negative effect of the bile. And the next one is the basic drug citrazine, which limited aqueous solubility. The presence of the food, see, it's an advantage for the cineriziner. Presence of food in stomach stimulates the HCl secretion. It is a basic drug with a limited aqueous solubility. So what happens in the presence of the food? Food actually stimulates the acid secretion, which lowers the pH. So what happens because of lowering pH is becoming acidic in nature, and citrazine is basic in nature. So now the environment becomes suitable for the citrazine to undergo dissolution. So that's why we can recommend cinerizine to take in the presence of the food. So like this. So when I don't want the food to be present because I know it is affecting its dissolution, then I have to recommend the person don't take the tablet immediately after the food. So this is one more example where the positive effect of the food for a drug example synergism. Okay. How does this happen? The presence of food decreases the pH. Lowers the pH means it's acidic. Lowering is acidic. Increase is basic. So next effect of the food is delaying stomach emptying. We already got idea in the tabular form, whatever we learned in the previous class, the various effects of factors which can affect the gastric emptying. Okay. So the food is also one, the type of the meat, temperature of the food, all this. Same here, we are just trying understanding with example. So delay means the presence of food may delay stomach intake of entry coated tablets, means this is negative effect I'm talking. The effect of food has a negative effect on the dosage form called as entry coated dosage form. Got it? So what happened? This results in the reduced bioavailability. Many times I have taken this example for your knowledge that entry coating are the one which actually should not release it has the polymer which is sensitive to the basic pH, or it solubilizes in the basic pH but not in the acidic pH. We are protecting the drug getting degraded in the stomach because of the pH condition. So that's why that coating is called enteric coating. So what happens in the delay in stomach emptying takes place, and that delay is what happening even because of the presence of the food. So the presence of the food results in the delay in the stomach emptying. Means the stomach content is not moving ahead, and because of which what happens, the entry coated tablet is unnecessarily sitting in the stomach, and there is a chance that since it is exposed for a very prolonged time in the acidic pH, there is a chance that tablet loses its integrity, in the sense it maybe the polymer is sensitive to the basic pH, but due to long exposure to the acidic pH, there is a chance that the drug leakage may start happening in the stomach. So this results in the release of the drug in the stomach pH also, and which may not be desirable. Okay, and that reduces the viability of the effect. So hope you are tabulating the positive and the negative effect. Next, drugs such as erythromycin iron, salts, aspirin, and non-steroidal anti-inflammatory drug substances. No, they are irritant to the GI mucus, and this is the positive effect I am giving the example. Hence, they are given with the food and reduces the gastric irritation. The positive effect, one more example of the positive effect of the food is I am minimizing the irritation caused by some of the drugs. Okay, where I recommend the uh, uh, consumption of the dosage form in the presence of the food, thereby it minimizes the irritation. So this is the example of the positive effect of the food. The next is fluid volume. I told you fluid volume, and also the consistency of the meal. Viscous, high viscous, low viscous. High viscous takes longer time to get emptied. Okay, like this. Fluid volume tend to distend the stomach and speed up the gastric emptying. However, large volume nutrient with high calories delay the gastric emptying. Means this is the effect of food with respect to the volume. So fluid, I mean, larger the volume, there's a chance of faster gastric emptying. But this the large volume with rich in the calories, that is a fatty substance. Same large volume, same quantity of volume only, but rich in the gastric, that is fatty substances that delays the gastric emptying. So it's not only the volume actually which is affecting the emptying process, but it is also the type of food content present in that volume is also important. Okay. So next one is reduce absorption due to interaction. The food and drug interaction is the common thing which you can also expect. And the best example every time you get to see interaction means tetracycline interaction with the calcium carbonate. Okay. So consumption of the tetracycline, and you must have also read somewhere the yellow deposit on the teeth when you take the tetracycline. It's mainly because of this. So the interaction of the tetracycline with the calcium. So don't take the tetracycline hydrochloride in the presence of the food because it forms the complex, and that complex reduces the absorption. So this is the negative effect of the food on the drug absorption, and example is the tetracycline interaction with the milk, and milk is rich in the calcium. So some other just one more thing I want to stress upon, the timing of the drug. That's what. So I already told many with so many examples the timing when the drug should be administered. All that is decided based on the type of the drug, okay, and then it's and how it is getting affected by the presence of the food. Depending on all that information only, we will decide the timing of the drug. So 1 hour before or 2 hours after, depending on the type of the meal and the therapeutic action. Now already you have written down the examples which is getting increased in the presence of the food or which is getting decreased in the presence of the food. So this information, based on this only, they will decide whether it should be given 1 hour before or 2 hours after. If I'm not wrong, it's whatever whichever tablet you take for subsiding the gastric irritation, no, that is your ranitidine. They generally recommend to take half an hour before the food because you want your body to be ready when the acid secretion start. It will start getting neutralized. Okay, maybe I feel this is the correct example I'm giving, but if I'm wrong, please let me know. Okay, but omeprazole or the trazoles, whatever you take, no, they don't actually recommend that you take before food or after food. Okay, because it is a proton inhibitor. It doesn't directly neutralize the acid secretion, but it inhibits the proton and thereby it inhibits the secretion of the acid. But ranitidine, it has direct effect. Sorry, antacids. Maybe I use the wrong word. Ranitidine, antacid. If I'm not wrong, they will ask you to take it before food. So say some confusion with the drugs name for me. So look at this, cimetidine and famotidine are taken before meal. That's what ranitidine. This made me to remember ranitidine. Cimetidine and famotidine are taken before meal to curb the acid secretion. So ranitidine example is correct, whatever I told. Same thing, the alendronate sodium. Okay, this is used for osteoporosis are very soluble in water, and the systemic oral absorption is greatly reduced in the presence of the food. So the fact of alendronate sodium is it should not be, it is solubility is affected in the presence of the food. So must be taken at least 1.5 hours before the first food beverage or medication of the day with plain water. Or you take after food also, maybe 2 hours later. But don't take immediately, or don't eat food immediate after taking the tablet. So because it has poor solubility in the presence of the food. Same, I'm just giving the examples like presence of fatty food. If at all you consume, having that information, we need to guide the patient to take the tablet behind 2 hours for those drugs which actually affected by the presence of the fattiness. So the example is ciprodoxamine, proxetine antibiotic absorption is enhanced with the food, or if the drug is taken closely after a heavy meal. Okay. Now, chrysoflavin, once again, the example comes here, and then now by this time you are confident to say that chrysoflavin are recommended to take immediate after the food, because the reason is its absorption is enhanced. Same with penicillin tetracycline, absorption decreases with high fat calories. So, this information made me to decide when the drug should be taken. So the timing of the drug, this is just an additional information I just added up. The timing of the drug, when it should be taken, is decided based on the type of the drug and its effect, or how it is getting affected in the presence of the food. So with this knowledge, we are able to come out with the regimen or the timing of the drug when to be taken. The last factor which will be concluding is uh, some of the like drug-drug interaction and the pathological condition, other factors affecting the drug absorption other than the food. The next one is the drug-drug interaction where two drugs administered together. That is called as co-administration. Like again, the tetracycline example comes into picture where you are actually giving the antacids along with the tetracycline. It's not a right combination. Okay, so co-administered sodium carbonate, bicarbonate can reduce tetracycline dissolution due to increased pH. So other reason, and the complex formation, the sodium bicarbonate increases the pH and it becomes basic in nature, in which the tetracycline solubility is altered or it is reduced. Okay, but in other case, same tetracycline example in the last point you can see, it forms unabsorbable complex, okay, containing when you take tetracycline along with the calcium, not the sodium, not sodium bicarbonate, it's the calcium. Calcium containing food along with the tetracycline. Again, that complexation is the best example. Or you're taking supplements like calcium tablets you're taking, like antacids or antacids you are taking, then what happens? The antacids should not be taken along with the tetracycline. So tetracycline example you can see in the two different points. In one case, the sodium bicarbonate should not be taken along with tetracycline because this sodium bicarbonate is reducing the dissolution of the tetracycline. Why? The sodium bicarbonate increases the pH. So the basic pH is not suitable for the tetracycline to solubilize. So that's the reason you should not give the sodium bicarbonate along with the tetracycline. Another reason, don't give antacids along with tetracycline because it forms the complexation. So, okay, the co-administered drug can or the result in drug-drug interaction, which can result in the formation of the complex or which can result in increasing the pH, which may be drawback for the absorption of the drug. The next is one more example, absorption, like antidiarrheal preparations when we give containing, like this usually contains some of the adsorbents, like Kevolin example. It prevents absorption of many drugs co-administered with them. See, this Kevolin has one property, whatever it feels convenient, it starts absorbing itself. So the drug, co-administered drug, along with antidiarrheal preparation if you are giving, this Kevolin, what it does actually start absorbing the co-administered drug and will not let that drug to get absorbed. So that's called as drug-drug interaction. In what way it causes the interaction? It may be different mechanism. In first case, it increases the pH. In the second case, it results in because the absorption, the interaction is happening. In the third case, the interaction is happening because of the complexation. So, like this, the drug-drug interaction can be any of this. So that was an interaction example. The drug itself can cause its own trouble. It can result in, it can invite its own trouble. Let us see some of the examples here. Propantholene bromide slows stomach emptying and motility of intestine and stomach acid secretion, hence delay in the absorption. So propantholene bromide, it reduces its own absorption because it reduces the emptying. Yes, it slows down the gastric emptying, also the motility of the intestine, and also it reduces the stomach acid secretion. All these are not suitable in things for the propantholene absorption. So it delays unnecessarily. It is, you cannot do anything for this because it is its property. So it delays its own absorption because of the alteration in the emptying process or the motility of the intestine. The next one is metoclopramide stimulates stomach contraction and reduces effective time for absorption of drug like digoxin. Means this metoclopramide actually is not interacting with the digoxin. Instead of that, see previous example, whatever we learned, it's actually the interaction. But here, the drug and drug is not interacting. Okay, instead of that, this metoclopramide is altering the GI condition. It stimulates the stomach contraction and reduces the effective time for the absorption of drug like digoxin. So the digoxin should not be administered along with the metoclopramide. Okay. The next one is or any other drug. Example, it may not be the digoxin, even any other drug. For example, if you administer with the metoclopramide, there is a chance that the other drug absorption is hampered. Now, the next example is cholestyramine absorbs, sorry, not absorbs, adsorbs warfarin, thyroxine, and it is and loperamide, thereby reducing the absorption. Okay, so cholestyramine absorbs the warfarin, thyroxine, and loperamide, and thereby reducing the. Just try to remember this one examples, and depending on the question they ask, you have to justify your answer with these examples. So, okay, so absorption. The next last example is calcium binds to protein in the presence of vitamin D and increases the absorption of calcium. So it's an advantage. So this the presence of any other drug can be an advantage or it can be the drawback. So in case of the last example where the calcium is binding to protein in the presence of vitamin D and increases the absorption of the calcium, and this is a well-known example everybody knows like vitamin D and the calcium relationship. The last part is the disease state, how the disease condition can affect the absorption of the drug. The disease state, any disease states which can alter like this, which can alter intestinal blood flow, or which can alter gastrointestinal motility, change the stomach emptying, gastric pH, intestinal pH, bile secretion, digestive enzymes, any diseases which can result in these changes can affect the absorption process. So major diseases which of our concern is always the which affects the absorption is GI disease, cardiovascular disease, and the hepatic disease. These are the major diseases which can actually causes lot of effect on the absorption of the drug. So some example, if when I say GI disease, The G, I told you the colon part especially, or any other region of the GIT. The celiac disease, Crohn's disease, these are all associated with the colon region. And any surgery which had been done for the GI tract, any kind of surgery, even that can alter the absorption of the drug. Celiac disease is, as I said, is associated with the colon, characterized by destruction of villi and microvilli. Okay, that is the intestine, sorry. Crohn's disease is mainly associated with the bowel wall, that is the colon. Unnecessary thickening of the wall, and because of that, overgrowth of anaerobic bacteria and decreased gut surface area results in the impaired absorption. So, celiac disease is something to do with the alteration or the disturbance in the villi and microvilli. Crohn's disease is something to do with the colon part, where the unnecessary thickness, building up of the increase in the thickness of the gut wall. Gut means always related to the colon. So this examples of the drug are ciprofloxacin absorption increases. See, destruction in the microvilli, is associated with the increased GI emptying rate and GI permeability. It alters overall the permeation property of the intestine. So unnecessary absorption will happen. This can be a drawback. So it increases ciprofloxacin absorption. Example, one of the drug whose absorption is increased, but this increased absorption, I'm not telling with